I went to like a drifting event. I've done a few like sessions where I've got like little kids who come and they're like, can I sit in the car with you? I've seen you drift and it's so cool. And I was like, yeah.
And you let them get in the car?
Yeah.
Those parents need to be arrested. That's not okay.
The event is actually really cool. They allow any kids over the age of 12 to learn how to drift.
12? They don't even have a license.
Yeah.
What are they drifting? Hot Wheels? Hi guys, welcome back to another episode of Yap and Jab. I'm Jessie.
And I'm Snow.
And today we'll be talking about preventative treatments and when you should start receiving these treatments.
Mm-hmm.
But first, I think we should talk about Snow's hidden talent.
Our hidden talents, because I know one of yours as well.
Your hidden talent. I think it's no one would ever expect it because she's so soft and innocent and sweet.
I'm learning how to drift my car.
I wouldn't say learning, she's drifting.
Learning on like a wet pan at Eastern Creek. So I started a couple years ago and I only do it ever so often because it's quite expensive. But I went to an event, like a drifting event, and I was just watching at the time.
Tokyo Drift? You wear like a mini skirt with your hair in like little ponytails?
Oh, Toki. Oh. But I was watching these cars go around in a circle and they were like learning how to like drift sideways, and I was like, holy shit, this is so cool. I want to learn how to do this. I turned over to Arden, who was watching as well, and I was like, Arden, I want to do this. And he's like, okay, let's do it. And like maybe a month later, I went to Melbourne, bought myself a ute, like a decked out VS ute, Honda ute.
Oh my God.
Holden ute, sorry.
Yeah.
And Arden did a few drift mods for me, and then like a month after that, we were on the drift pan. I was learning how to drive manual at first, and then straight on the wet pan to learn how to drift.
Oh.
Yeah.
Do you think you're a professional at it now?
No. I'm still
like,
very amateur.
Would you feel comfortable if I was in the car with you? Like, do you feel like we wouldn't die?
No, we wouldn't die.
I think it'd be fun.
Yeah.
Because like when I go on roller coasters, like I went to Disney World in Tokyo. It was in Tokyo in Japan.
Mm.
And there's like 4-year-olds on the roller coaster and they weren't even blinking, and I was screaming my head off. No, it was bad. Like everyone, like, you know when you go down you put your hands up, and I was like, yeah, like down the thing, and I'm like and then everyone got scared, not from the slide, from my reaction. So I think I want to go in with you. I think it'd be
hell yeah.
Good bonding session.
Yeah, because I've done a few like sessions where I've got like little kids who come and they're like, can I sit in the car with you? I've seen you drift and it's so cool. And I was like, yeah.
And you let them get in the car?
Yeah.
Those parents need to be arrested. That's not okay.
The event is actually really cool. They allow any kids over the age of, I think, like 12 to learn how to drift.
Someone needs to investigate that. 12? They don't even have a license.
Yeah.
What are they drifting? Hot Wheels, like little spin cars?
Mini carts. Mini go-karts.
Like actually motor vehicles.
Yeah.
A 12-year-old.
As long as you have like another person to like teach you, then that's fine.
What?
Yeah, it's really cool. It's like open. They have like female events as well, like for female events, beginner events, more like more pro drifters and stuff like that.
Well, at least they have this facility for people that want to do this, because imagine they didn't and people were just doing this on our streets.
On the street.
Yeah, but 12 years old drifting.
Yeah. I learnt my first donut on the street. And it's like on a wet day, I was like, let's go. I want to learn. On a
roundabout or something?
Like literally like on a big wide road just in Concord near where we live. And it was so fun. But like I feel like being able to do it on like an event like that, you get a lot more like seat time, and you learn so much faster than just doing like a little couple bends on the street.
Yeah.
It's really cool. I really like
a built up area of like children and families.
That's how I want to raise my kids. I want to raise them to learn how to like drift, ride motorbikes, dirt bikes, whatever.
See, my dad made me get on motorbikes, and that wasn't a great experience for me. It wasn't. No. Yeah, I think my stepmom like broke her nose on one of them. Yeah, they're dangerous vehicles.
Stop.
Yeah, but
I did break my toe and my finger on a scooter and a motorbike.
Great. I've never broken a bone.
Haven't you?
Never. But they say people that don't break their bones suffer more internally with emotions. So maybe
I guess I'm mentally stable then, because
I'm mentally stable. What the fuck?
I broke both of my elbows before falling down some stairs.
Well, you're vegan. Maybe you're just brittle.
Maybe. No calcium, no milk. Anyways, let's talk about your hidden talent.
Oh, there's many. But I think my most proud hidden talent is I can park a semi-trailer. And you wouldn't think it. Like, I could park any vehicle.
That's so
in
cool.
between little poles. Like, I am like a professional parker.
That's so cool.
Yeah. You should see my car spot at work. It's
tiny.
It's tiny and I have a big car and it works. It's like a glove. But I think that's my hidden talent that comes off the top of my head, and finding parking. Like, even my friends, like when we'll go to an event or we'll go to a restaurant, they're like, we're not going to get a park. I'm like, what? I'll get a park right at the front. It's like a blessing. It's like my one thing. I never stress about parking because I know as soon as I turn up, someone's going to leave. And it will be VIP parking for Jessie.
You did mention that yesterday. Remember how Jai wanted to go to Henrietta's?
Yeah.
And she's like, we'll just take one car. And you're like, no, I want to drive.
Yeah.
And she's like, how are you going to find parking? You're like, I'll find a way.
Yeah, no, always. It's so weird.
Yeah.
Even my girlfriend, we're driving to Bondi, like icebergs, and she's like, you're not going to get a park. I'm like, watch me get a park. Who do you think you're talking to? And this person there was all these cars lined up like in front of like icebergs, and this guy just got out of his car just in front of me, and I just pulled straight in. Everyone was so angry, and she was like, that's not normal. I'm like, because you're negative. You're a negative person. I'm not a negative person. Do you know what I mean?
Yeah.
I guess that's my hidden talent. It's not much fun, but it's good.
Yeah, that's so
it's
cool.
handy.
It's fun how like both of our hidden talents have to do with something to do with cars.
I think because men or most people don't expect women to be able to park a car. Like, I remember I was parking once, there's all these tradies outside of work, like in my car spot, and they walked over and goes, shit. They couldn't believe it. They're like, what the? And I was just like, please. How dare you? You look at me and you think that.
Yeah.
Like, I can load your truck in here with a trailer with a jet ski and I won't need your help.
Cool.
Do you know what I mean? Like, but because it's such a masculine trait, I think men just don't expect women to park.
It's hard. I've tried reversing in a trailer. I couldn't do it. I was planning to go that way, but the trailer went this way. And I'm like, where the am I going?
You need to be skilled.
Yeah.
You need to be skilled.
Good on you.
Yeah. Anyway, let's hop into the episode.
Okay,
shall
let's
we?
do it. Today we're talking about preventative wrinkle treatments and when it's a good time to start.
I think it's a taboo subject. I think people are, not everyone, like I'm not embarrassed, but everyone's quite embarrassed to receive these treatments and be open about it. Like, I had a patient the other day, and I've been treating her for years. And I remember when I first started treating her, she came to me and she's like, I'm really embarrassed to get this done. Like, none of my friends do it. Like, but I just feel like I'm aging. I don't feel like myself. She was in her like premenopausal stage. And I said, why are you embarrassed? Like, you're just keeping fresh. You're looking how you did when you're in your 20s, your 30s. Do you know what I mean? Like, it's okay. It's fine to have a little bit of texture, but it's okay to feel good about yourself. It's just a medication at the end of the day. A lot of people take other medication for a lot of other things. This is just to make you feel better about yourself. And then I started treating her, and over a year, she's like, my friends and I, they just don't get it. So I just started talking to them about it. She's like, they all get it. They've all been getting it for the past 15 years. Yeah, she's like, no one talks about it because it's like they're embarrassed. I'm like, all the mums do it. I'm sorry. Majority of the mothers do wrinkle treatments, like especially after having a baby.
And if done well, you won't be able to tell.
Yeah, exactly. Like, you should still have subtle movement and feel fresh. I started when I was like 20. But that's because I was in the industry. So
I remember when I first started treating Arden, and he's really open about it. He's actually really excited. He tells all of his friends about it, his tradie friends, everybody.
Yeah.
And
men love it.
They wouldn't get it. His friends around him wouldn't get it. They're like, why do you get it? You're going to ruin your face, XYZ. And then I think it's been a couple of years now that Arden's had Botox, and now some of our friends, they come up to me and they're like, Snow, I'm thinking about it. I'm thinking about doing a little bit in my forehead. If I do it and I start, will I have to continue it? And a lot of times I go, no, like, let's try it. If you try like one treatment, you don't have to continue it if you don't like it. But I rest assure you, you're going to love it and you're going to continue.
100%. Men love it the most, I think.
Yeah.
If it's done well.
Yeah. Arden's convinced all of his tradie friends now. Sometimes, like, there was one time I had like his three tradie friends waiting in line. And then my my old boss at the time, she's like, who are these guys? Are they here to fix something?
Yeah. That's so
Yeah.
funny. I had a one client. He would come in and he would always wear his work uniform or some sort of trade, and he would pay me in the room because he was embarrassed of the people in the waiting room. And then he would walk out and say, okay, like, I'll see you in a few months to check that leak. And I'm just like, he's a dad. Like, I'm like, come on. No one cares. Everyone is so busy about thinking about themselves. They don't care what you're doing. They wouldn't even notice you walk in or out of the practice. Do you know what I mean? There's no reason to feel this way. But I think like a lot of people are being more open about it now. And it's, when you think about it, it's such a little procedure. It takes 15 minutes.
It's non-invasive.
Yeah.
You walk in like how you walk out.
Yeah.
You like sometimes
takes
you
2
can
weeks
barely...
to kick in. It's not like it's an instant thing. You're not going to get swelling. You're not going to have, potential bruising, but it's rare unless you've had a blood thinner in the past 24, 48 hours. But it's very minimal.
And it's progressive as well. So like when we inject the product or the medication, it starts slowly kicking in, roughly around 3 to 5 days, and slowly kicks in. And it's not going to happen like that. It slowly kicks in, and then by 2 weeks, it's like the full final result. Yeah.
And I think that's what people expect. They get the injection and then bam, they can't move their face. It's not like, it's very, very slow. So when it does kick in, you're kind of slowly getting used to the less movement of your face. Yeah.
And it's exciting. I remember the first time I actually had my wrinkle treatments. Every day I'd be looking in the mirror, making the movements.
Yeah.
Just to see how much restricted movements I'm getting over the days.
Yeah.
Yeah.
I love those clients when you like just inject them and they're like, oh my God, it's already working. And I'm like,
yes.
It's been 2 minutes. But I love that for you.
Yes. I get that.
I look so fresh. I'm like, yeah, you do.
It's so cute.
But I actually did have a friend, within 24 hours, she was frozen. So
it affects everyone so differently.
It depends on the person and your metabolism and how you react to the product, which is just a purified protein from bacteria, which has been used for years for like medical reasons. So we use this for cosmetic, but we also use it for medical, like for TMJ, headaches, like neck pain. I use it for my my traps, my platysmal bands. So it's used cosmetically and it's used medically. And it's been around for how many years? Like
decades.
And there's no long-term use like that's going to cause any issues other than just looking hot.
I had a
not saying people that don't do treatments aren't hot, but you're hotter.
Yeah.
You know what I mean?
I had a client when I was doing disability work. He every 6 months he would go into hospital and he'll get an injection into his bladder. So it weakens the muscles that contract, so he's able to flow into his bag easier.
Oh, poor thing. But it's an amazing medication.
They inject it in babies too.
Yeah. And for vocal cords as well. Like there's so many use of this medication. It's not just cosmetics. So when people talk badly about it, I'm like, you're just not educated. It's like me talking about plumbing. I just wouldn't do it. I wouldn't be telling a plumber how to do his job. Or do you know what I mean? You've seen something on TikTok, you've seen something on Instagram, it's put you off, or like you're just a Karen and you want to age gracefully, do you, but don't make other people feel a certain way because they look after themselves. That's how I look at it. Do you know what I mean?
Yeah.
Some people are just mean.
I get a proud moment every single time we inject a new patient. They come in, they trust us, and it's their first time, and I get so excited.
Yeah.
Because they're like, I trust you. I know that you're aligned with my goals. I just don't want to look like I ran through a wind tunnel and be super frozen. I'm like, that's fine.
I do.
But that's because you're so used to the treatment.
My eyelid's the only thing that moves.
No, I can't do it. I need to be able to animate my face. Sometimes if I'm too frozen,
when mine wears off, I get anxious.
Why is that though?
Because you're just movement I'm not used to anymore, which is fine.
Yeah. I had my DOs for the first time once, and I get quite anxious. And I remember one time I was catching the train home. I wasn't able to frown, and when I wasn't able to frown, I wasn't anxious, and I felt like I was smiling the whole time through the train ride. I'm like, oh, this is great. Like I'm like packed in like a sardine in the train, but I feel really great. I'm like smiling the whole time.
I would have an absolute anxiety attack if I was like that on the train. In Tokyo, I was like we were like up against each other, hot and heavy. But I don't know, in Japan it's different. But here, I'd feel like, you know, the people here are a bit more aggressive than Japan.
Sydney's terrible. We have like the worst road rage, the worst attitude when it comes to patients.
Everyone's entitled.
Yeah.
Or on public transport anyway.
I started my wrinkle treatments when I was 30, literally like right bang on 30. That's when I started mine. I noticed a couple of static lines. Yep. I obviously had the dynamic lines, but then I stared getting the static lines, and that's when I knew.
So static lines are like when you start to see the fold in the skin when you're... I can't move my face. I can't.
So how you know is that when you wear makeup and you can see a little bit of your makeup sit into the creases of the wrinkles. Yeah. And I think that's a good time to start thinking about doing wrinkle treatments, not necessarily having to do it right now. Yeah. But I think it's a good time to start thinking about it.
Yeah, I agree. And, you know, I think it depends on your lifestyle, on your background, like what does your mum or your dad have? Like some people, hereditary, they have these really, really deep 11 lines, which is just between your frown or like your eyebrows. So if your mum and dad has that, or they have like a really deep chin crease, more than likely you may get that as well if you don't treat the areas. You don't have to do this, you know, every 3 months. If you're quite young, if you're in your 20s, once or twice a year is fine. But again, like treating these areas will decrease the folding of the skin. You need to think of the skin as a piece of paper. If you scrunched up and fold it 1,000 times, you're going to see lines in the paper. But if you prevent the paper from folding, then you're not going to get these permanent lines when you're older. So we're basically maintaining your skin as it is and preserving it. I think like people understand this treatment is a preventative. I have clients come in with the, like, you know, in their 50s and they have the deepest 11s, they're the deepest crows or forehead, and like, I want this gone. I'm like, you come now? Because, you know, it gets to a point where they don't want to look at it anymore. Like, you should have come when you were younger and we could have prevented this. And like, anyway, we can help, definitely, but there's a lot more things. It will soften it.
It'll soften it over
time. But we'll
time.
have to combine treatments to really break down that permanent line.
Because the permanent line is due to a breakdown of collagen from repetitive movements of the wrinkles. Yeah. So combination treatments, I always recommend combination treatments with the tox and collagen stimulating treatments to give you the best effect. Yeah. So I don't feel like there's a right number. Yeah. I feel like maybe 20s to 30s is a good time to start. Yeah. But I definitely do have clients in their 40s that come in for the first time.
Yeah. I had a client in her 40s the other day and she had not one line on her face. I was amazed. Her skin was incredible. So again, it's not like, you know, you have to start at this age. It's different for everyone.
Different.
And the product can last in the tissue for about, like, it slowly kicks in. So you will notice once you have the injection, the 2 weeks, it slowly kicks in, then it's frozen. Then it starts to get more natural and then you have more movement. And then it slowly wears off. So at the 2.5 month, you kind of feel a little bit of movement and then it should completely wear off within the 3 to 4th month.
Yeah, I always tell my clients that by the time you're probably around 2 months in, you're about halfway through your treatment.
Yeah. Depending, like some people can get longer. Like in the frown, one of our products has been clinically proven to last up to 6 months. We don't guarantee that, but it can for some individuals. So it just depends how healthy you are, if you train a lot, what's your metabolism like, do you smoke, do you vape? All these contribute to the longevity of your treatments. So that's something to look, you know, you can speak about in a consultation as well. Other things you can take is zinc. Obviously, you just take the recommended dose, but zinc has been shown to potentially prolong the longevity of the treatment.
I also believe in dose equals to duration as well.
Mm.
So if your dosing isn't giving you the longevity that you're getting, maybe you may have to talk to your injector to see what they can sort of tailor and tweak your treatments to fit you.
Yeah.
Yeah.
Just a heavier dose. It's always good to start off like at a moderate dose and then you can work your way
Right.
up. See how you go.
Mm.
But I agree
Mm.
because
It's always trial and error, because sometimes you may need less, sometimes you may need more.
yeah.
Everyone's expectations of how they want to look is so different.
Yeah.
Not everyone wants to be super duper frozen, so we can definitely do a lighter dose, but you
Yeah.
may not just get the longevity, that's all.
I just can't deal with that term baby tox. I just want baby tox. I'm like, I'm not giving you baby tox. I'm giving you the appropriate dosage you need for your face.
Mm.
A baby tox, just a sprinkle. All right, I'll give you 5 units. See how that goes. You'll have one dot on your forehead that doesn't move. It doesn't make any sense. Like, oh, the term baby tox. It's you're a baby and you're getting tox, and I understand it. But like the dosage is just annoying.
Mm.
You just need to take the recommended dose from your provider as long as you trust them.
Yeah.
Always go to someone that's either referred to you or you've done your research.
Mm.
There's other preventatives like that you can do at home, like taking, using retinol or vitamin C, doing microneedling, even like a roller at home, using SPF every day, not using tanning beds or roasting your face on Bondi Beach. That will help.
Yeah. I find that the clients that come in who treat their skin and look after their skin usually are the ones that don't need tox early on in their lives. Usually they come later on in life to get the tox, just because their skin is so healthy that it doesn't create any of the static lines that we spoke about.
Yeah. Sleep on a silk pillowcase, no, seriously.
No.
I have a silk pillowcase and a silk bonnet for my hair.
Yeah.
Well, the way I go to bed, it's atrocious. No, there's like a mask on. It's just, looking after your skin is important.
Yeah.
And doing things at home and in clinic, treatments, it's a combination of treatments to preserve your skin. So
yeah, I see it holistically. I see it like a holistic picture from like top to toe, rather than just treating like that 3 areas of the face.
Even supplements, collagen. I drink collagen water every day. So there's a lot of things you can do. We're not treating your age, we're treating your pattern. So we're not trying to change how you look. We're just trying to keep you fresh and looking young and lifted, because no one wants to feel heavy and cranky and squint around all day. Wear some sunglasses and get some tox in your frown. Yeah. That's it. Well, that's it for today, guys, but we'll answer some questions. So Snow, I have a question for you. If my lines are only present when I smile or frown, should I consider treatment or should I wait until they're more permanent when I'm not expressing?
I feel like we may have similar or different answers to this, but I'm going to say it really depends and it's entirely up to you. When you are smiling and frowning and you have these lines, do they bother you, or
how do they make you feel?
If they bother you and you feel like you want to improve on them, then I feel like, yes, let's start now. But if they don't bother you and they're not a concern for you, then I feel like you can wait. You can wait, because then, you can
a little bit of texture and expression is quite nice.
Lived in expression is nice.
It makes you, I feel a little bit more, I guess, genuine when you're speaking. Because I have the resting bitch face. But it just depends. Like, obviously, at the time when you're expressing and you see those lines, that's the collagen breaking down. So if they don't bother you, but you don't want them to get worse, you could do one treatment a year. And that will prevent it from getting too deep before it becomes permanent. But it also depends on your goal. Like, what's your aesthetic goal for your future? Like, if you don't mind them and you like a little bit of texture, leave it do one treatment a year, or just leave it and come when it starts to bother you. But again, when you leave it and then it starts to bother you, it's harder to reverse it. So if you're happy at how you look now when you're not expressing and you have no lines, then I recommend coming in if that's how you like to look. But if you don't mind a little bit of texture, even when you're not expressing,
Mm.
then it's time to come in.
Mm.
Or it's time not to do it. What did I say? I don't
Yeah,
remember.
that's
Yeah.
right. Because I totally agree with you. I thought we might have been a little bit different on this, but
Oh, what? Because I can't move.
you're like, I want to be
doll.
frozen.
Remember my hairdresser yesterday? He was so rude. Oh, you're a doll. Like no, everyone will expect that opinion from me, but it just depends how how you like to look. If you like to have a shiny, glossy forehead and not much movement and lifted, then yeah, do it. If you like texture, like if you're an actor, if you need expression for your children, microdose it or do it once or twice a year.
Yeah.
That's it.
Yeah.
It's not one size fits all.
I do admit that like when I'm at the beginning of my like the start of the treatment, I feel so fresh. My skin is glowy. I see the reflection on my forehead like a disco ball, and I love that. And then I do because I do tox only twice a year. By the end of the 6 months, I feel a little bit raggedy, and I'm like, okay, it's time to start again.
Bobo time.
Bobo time. And we have another question from the viewers. If I stop the treatment over a couple years, will my lines come back worse?
No.
Absolutely not.
Absolutely not. That is the biggest myth. I don't know if you've seen Pamela Anderson. She just stopped receiving all treatments. She stopped wearing makeup. She's going onto the red carpet looking just like, wants to feel like herself. And she's starting to get little lines, but her lines are like an 18-year-old would have more lines than her. It doesn't come back worse. You will just start to naturally age as your muscles gain their strength back. You got to think as, you go to the gym, you build your muscle by working out. It takes time to build that muscle. Same with your face. So when you've paralyzed your muscles, your frown, your frontalis around your eyes, the muscle gets quite weak. So it's going to take time for that muscle to build its strength back up. So the lines will take a while to come back. They're not just going to come back like you were when you were 18 because you've been expressing for 18 years of your life. And when you see a little cute little baby and it's like, it makes that little frown. Like you're expressing the soon you come out of that wound. It's you know what I mean? You have a frown, you have a little forehead line. So it takes time for the muscle to regain its strength, and then you'll start getting some lines, some texture. If you like it, keep it. If you don't, do some more treatments. It doesn't come back worse.
And just remember the lines in your, like the forehead, the muscles in your forehead, they're so thin. You're not going to have a bicep on your forehead after a couple of years. You know what I mean? So you'll be fine.
Yeah. That's it for this week's episode, guys. We'll see you next week.
See you for now.